Next is your Loa Loa. Your Loa Loa is also called the African eyeworm, and it is passed on to the humans through the repeated bites of your deer flies, and those are also known as mango flies or mangrove flies of the genus Chrysops. So the female worms measure 40 to 70 millimeters in length and 0.5 millimeters in diameter, and the males measure 30 to 34 millimeter in length and 0.35 to 0.43 millimeters in diameter. The adults produce microfilariae measuring 250 to 300 micrometer by 6 to 8 micrometer, which are sheeted, no? And they have diurnal periodicity. The microfilariae have been recovered from CSF, urine, and sputum. During the day, they are found in your peripheral blood, and during their non-circulation phase, they are found in your lungs. So if you were infected with this parasite, they causes repeated episodes of itchy swellings of the body known as your Calabar swellings. The vector for Loa Loa filariasis are flies from two species of the genus Chrysops, as your Chrysops silacea and Chrysops timidata. So for the life cycle, during a blood meal, an infected Chrysops fly, they introduce the third stage filarial larvae onto the skin of the human host, where they penetrate into the bite wound. So, yung larvae na yun, they develop into adults and they commonly reside in your subcutaneous tissues. And the adult worm, no, they can be visualized migrating the bulbar conjunctiva. No, that's a part of your conjunctiva, a clear membrane of the eye which covers the outer surface of the eye. Yan, that's your bulbar conjunctiva. Yan, diba? You can see the worm. So, when yung mga fly, they ingest the microfilariae during a blood meal, doon sa fly na stage, dito na tayo. The fly, after ingestion, the microfilariae loses their sheaths and they migrate from the fly's midgut through the hemocoel to the thoracic muscles of the arthropod. And there, the microfilariae develop into first stage larvae and subsequently into third stage infective larvae. The third stage infective larvae migrate to the fly's proboscis and can infect another human when the fly takes a blood meal. Yan, so that is the life cycle. So for the diagnosis, the identification of the adult worm by a pathologist after its removal from the skin or the eye. And it should be identified by a healthcare provider and pathologist yun ang nagabasaan eh. Then identification of the microfilariae on a blood smear made from blood taken from the patient between 10 a.m. and 2 p.m. So there is also a specialized blood test for the identification of antibodies against your Loa Loa. And although surgical removal of adult worms moving under the skin or across the eye can be done to relieve anxiety, it's not cured by surgery alone. So this is the surgical removal of the worm. Yan. So treatment of choice is your DEC, which kills the microfilariae and adult worms, and albendazole is sometimes used in patients who are not cured with multiple DEC treatments. It is thought to kill adult worms. So thank you.